everybody. This is Dr. Burghardt. I am going to go over in this video your depression as a side effect activity. So let's start right off with the activity here. The first thing that we'll do is we'll actually just work on the table, and then we'll come back to those two articles that I posted for you. So the first thing it says is look up the top 10 most frequently prescribed drugs for the current month. And so I gave you a hint there to search top prescriptions in GoodRx. And the most recent data will be listed on their website. How many list depression or a change in mood as a side effect? Fill in the table below. So let's go ahead and take a look at that GoodRx site. Okay, so if you see I searched top prescriptions GoodRx in Google, and the first search result that comes up is the top 10 most popular prescriptions in GoodRx. And so the way they actually do this is they look at prescription drug fills versus popular. Could be kind of an ambiguous term. But for January 2020 is what we're looking at right now. And you can see the top 10 drugs, and many of you probably see these all the time when you're in your internships or on your night job there. So atorvastatin's number 1, levothyroxine, lisinopril, gabapentin, amlodipine, albuterol, Vicodin, omeprazole, amoxicillin, and finally, losartan. So those are our top 10 drugs, and those go in the first column of our table. So let's go fill that in. So as you can see, we have all top 10 drugs filled into the table. So let's next fill out the next column, which is what are they used for? Okay, so we filled in the disease states that these medications are used for. As you can see, hypertension lands on 3 of them. And then we have atorvastatin with dyslipidemia, levothyroxine for hypothyroid, gabapentin nerve pain seizures, albuterol, asthma bronchospasm, Vicodin for pain, omeprazole GERD, and finally amoxicillin for infections. So let's move on and start to look these drugs up in some drug info programs to see if they list side effect or depression as a side effect or some sort of other psychiatric side effect. So for the purposes of this instruction, I'm going to use 2 different sources here in mine. The first is going to be Micromedex, and the other one's going to be Lexicomp through up to date. Okay, so let's get started with the first one. I'll show you just the first one as an example of what I did, and then I'll just show you the rest of the table filled out. And it's okay if you use different sources, because the point that we're going to see here is that different sources might give you different answers. Okay, so now we're on the Micromedex homepage. Let's go ahead and look up atorvastatin for its drug info. So it pulls us to the drug info page. We want to pick adverse events or effects. And really, we're looking under the neurologic category here. As you can see in Micromedex, under common, atorvastatin has no neurologic side effects, and under serious, it does, but it really has nothing to do with mental health. So that's probably going to be a no on the Micromedex drug info program. Now let's switch over to Lexicomp through up to date. And here we are in up to date. So let's go ahead and search atorvastatin. There you go. It comes right up. We'll go ahead and click that. And then always on the right and up to date is the Lexicomp drug information. And then we'll scroll down and we'll find adverse reactions. And right off the bat, you can see that Lexicomp lists a lot more inclusive side effects from the drug labeling. And so we're going to again go into central nervous system would be what we'll look under Lexicomp. So insomnia, malaise, nightmares. So that might actually already check the box for other mental health side effects, but let's keep going. So they have some down here where they're post-marketing or case reports. And so let's start to look. We got, let's see, anorexia. I guess that technically lands under DSM diagnosis. Oh, there we go. Depression. And if we keep moving on, see if there's any other memory impairment. Possibly it would land under what we're looking for. And that looks like it's mostly it. So depression is a big one, and we possibly found some other psychiatric side effects. So let's go back on and fill out our table. So filling out our table, we had a no for Micromedex, but we had a yes for up to date. And what we actually found was definitely a yes for depression as a side effect. And then alongside that, we found a likely yes for other psychiatric side effects that we found. So I'm going to go through and fill out the rest of the table, and then we'll talk about it a little bit. Okay, so I filled out the rest of the table, and let's take a look at the overview here. So you can see, let's see, all but 2 medications had some sort of depression listed in the side effect list. The only 2 that didn't was levothyroxine and amoxicillin, at least for Micromedex and up-to-date Lexicomp that I searched. And then almost all, except for 1, which was lisinopril, listed some sort of other psychiatric side effects. So obviously, this is a pretty wide net that I'm casting on some sort of other psychiatric side effect. However, as you can see, overall, of the top 10 medications that are prescribed, 80 to 90% have some sort of psychiatric side effect. And then to compare between the 2 drug info resources, what you can see here is pretty interesting. Micromedex is pretty specific in what they list for their adverse events. As you can see, there was only 2 yeses where I found either depression or a psychiatric side effect in Micromedex. And that's really because Micromedex only lists those fairly common side effects or serious side effects. So it's not going to capture what would be much more rare side effect, right, which would be depression or a psychiatric side effect. Because if those were common side effects, it'd be very unlikely that the drug would be commonly prescribed. Now, obviously, there is some yeses here in the more common side effects, but that would be my wide net applying to other psychiatric side effects. And then if we compare it to Lexicomp, which does a much more in-depth reporting of adverse events in their drug information. So essentially, we saw before, they do that greater than 10%, 1 to 10%, and then less 1%. Really, the less to 1% is where I'm finding the majority of all these yeses over here. And as you can see, for Lexicomp, every single one was yes, the whole way down. So really, this kind of shows you 2 things. First, that depression as a side effect is very common in side effect listings and drug labels, and it can depend on the drug information source you're using. So that's just something to be aware of. Okay, so let's move on to the next question, which is, do you think there's a high potential for a patient to receive multiple top 10 drugs that cause depression or changes in mood? Give an example of a patient where this might be the case. So this is a pretty straightforward question here. The point I wanted to get across was that, of course, especially with these really common medications in the top 10, it's very likely patients will be on multiple medications. And we'll talk about the importance of that when we go over the study here. So you could have given me a plethora of examples. You could have given me elderly people who are on multiple polypharmacy medications. Here I'm going to give you an example of a patient that has metabolic syndrome. So let's review metabolic syndrome. I'm pretty sure that you've had it, but perhaps you haven't. So metabolic syndrome is a constellation of metabolic symptoms that include pre or full states of obesity, diabetes, hypertension, and dyslipidemia. So in order to have metabolic syndrome, there's actually several criteria that go into this. For example, you have to have a certain glucose level. You have to have a certain waist circumference for obesity, glucose level for diabetes. You have to have a certain level of essentially high blood pressure, and then you have to have certain levels of specific parts of a lipid panel. And it doesn't have to be a full lipid panel dysregulation. And generally what we look at there is triglycerides. But nevertheless, what you can see here is easily patients will be on multiple medications from the list that we did above. So obviously hypertension, there were 3 meds on that list. So the likelihood that they'll be on at least one is quite high. Dyslipidemia, the top med was atorvastatin. So the likelihood that they're at least on a statin, which would have similar side effects to atorvastatin, is quite high. Diabetes mellitus, which actually isn't in the top 10. They are going to clearly be on a medication for that if they had it, and it will be metformin, which actually surprises me that it's not on the top 10 list. And then obesity, there are some obesity drugs that you all have learned about. However, they're not in the top 10 yet. I can imagine them someday being in the top 10. So there's multiple drugs that might be tried for that. Okay, so essentially what this tells us is that it's pretty easy for patients to be on, greater than to equal to 3 medications that have some sort of association or listing of depression as a side effect. So let's keep that in mind as we move to the last question in this activity. So the last question in this activity is list the possible reasons that could explain the association between medications that have a side effect of depression and the increased risk of depression. So did the article or the Cato study that I linked you to, that I provided, answer of these potential concerns? So let's go ahead and go to these studies and kind of go through them quickly and see if there's any ideas we can at least figure out from reading them on what could explain these associations beyond just being an actual medication-induced cause of depression. So the first article we'll talk about is the actual JAMA article that the second article is based on, and that's the prevalence of prescription medications with depression as a potential adverse event among adults in the United States. So this pretty neat study was done by a pharmacist out of the University of Illinois, I believe, and essentially what they did was they looked at the NHANES survey to examine how many patients were on medications with depression as a potential side effect and compared to patients that weren't. So let's start to go through this. Key points that they list here is the question is how frequently do U.S. adults use prescription medications with depression as a potential adverse event, and is the use of these medications associated with concurrent depression? Essentially what they find is that they find an increased prevalence of U.S. adults using medications with depression as a potential adverse event. And really they say their meaning here is the use of prescription medications that have depression as a potential adverse event is common and associated with a greater likelihood of concurrent depression. So again, they use the National Health and Nutrition Examination, or NHANES survey, which is actually publicly available. They used 2 different cycles of it, as you can see here in adults 18 and older. They used a depression assessment in it called the Patient Health Questionnaire 9, which consists of 9 questions about depression, and that's included on the NHANES, and that's actually given and can be self-administered as well. So that's included with the NHANES. And then they actually looked at prescription medication data, which was collected during the household interview based portion of the NHANES. And they go ahead and they define in here how they look at the use of prescription medications. How did they look at depression as an adverse event? They looked at prescription medications that had potential for depression, including suicidal ideations, using Micromedex, which is one of the ones that I used in this video. And so they tell you which medications they actually looked for these words within the listings. And so a good thing to remember is that what I found when I searched, I'm not sure, maybe they did an expanded adverse event search, was that, again, there weren't a ton of medications that actually had the side effect listed in Micromedex. So something to keep in mind. They also looked at a bunch of other variables in there in order to control for it in their regression. So they did some pretty powerful statistical analyses where they could control, to the best of their ability in a cross-sectional study, confounding factors. And then finally, they did a series of sensitivity analyses, and the most important, probably the one that we'll just reference quickly as we go through the results, is essentially peeling out patients that were on a antidepressant, because again, you could have reverse causation there, right? If you just did a study where you didn't account for that, one could easily say, well, you had a bunch of patients in your sample set that are on antidepressants with depression. Of course, you're going to find some sort of association of medication use there. And instead, they did a sensitivity analysis where they separated those out. And we'll take a look at the results. So what was the main finding from the study? They found that of their population that they included in here, which I believe was somewhere in the ballpark of 26,000 people, about 62%, so almost 2/3, did not use any prescription medication that had depression as a potential adverse event in the prior 30 days. Whereas on the flip side, of course, about 1/3 did label that they used or did have at least some sort of medication on board that listed depression as an adverse event. And overall, in their population, 7.6%, based on the PHQ-9, reported depression during the study period. Okay, so let's look at the main table here, which is the prevalence and use of prescription medication with depression as a potential adverse event. So table 1. And what you can see here in their 26,000 patients, again, here's that about 2/3 that were not using a medication with depression as an adverse event versus 1/3 that were. And you can see that's statistically significant. And then basically as we move down the table, you can see that those that there was a significant difference between patients based on age, based on sex, based on race and ethnicity, where there was a significant amount of patients that were taking a medication with depression listed as an adverse event. Education was not significant, but all the rest were significant. So the next table of interest, I think, is table 3, which looks at the association again between prescription medications with depression as potential adverse event and depression amongst adults. So looking at that PHQ score again, which they defined as above 10. And what they did is break down patients as based on the number of medications with depression as an adverse event and the number of medications without depression as an adverse event. And what you can see here, again, they looked at an unadjusted, which would be a raw value, which would be questionable because you could say there's a lot of confounding factors, versus in the adjusted model, that just means they adjusted for many, many things, including survey cycle, number of medications with depression as a potential adverse event, number of medications without, long-term use of them, and so on and so forth. And especially these important ones like sex, age group, race, ethnicity. So this is a very much more probably powerful value here because it's actually adjusted for certain confounding factors. But what they found was that as you increase from 0 to 3 or more number of medications with depression as an adverse event, what we see here is the percentage of patients that actually have a PHQ score of greater than 10, so considered depression, increases significantly. It goes from 4.7% all the way to 15.3%. So that's a pretty big increase. And if you compare that to the number of medications without depression as an adverse effect, as those increase, what we really see is no difference whatsoever. If you're on 0 medications without a depression as an adverse event, it's 5.5% have a PHQ score greater than 10, which is very similar to the above part here in the table. And then as you go down and increase the number of medications that don't have depression as a side effect, it stays pretty much exactly the same. And that's reflected by the non-significant p-values here. Table 4 really captures the sensitivity analysis. So it's very similar to Table 3, except for looking at U.S. adults treated with antidepressants. And what you can see here is when you increase the number of medications with depression as an adverse event from 0 to 3 for patients on antidepressants, we can see again there's a significant increase in the number of patients that have depression based on the PHQ-9 score of greater than 10, starting with 14.2% have that high PHQ score, all the way to 28.2, so getting up to almost 1/3 of patients having a PHQ-9 score greater than 10. And when you compare that to number of medications without depression as an adverse event, it really doesn't differ between 0 and 3 medications. So what we can see here is that irregardless of being on an antidepressant or not, when you increase the number of medications with adverse events, it seems to significantly increase your risk of having a high depression score. So in the first paragraph of the discussion, which is pretty standard for almost all papers, they really capture what they found. So in this cross-sectional survey study, reported use of prescription medications that have depression as an adverse effect was common. Use of multiple prescription medications with these potential effects was associated with a greater likelihood of concurrent depression. These findings persisted in analyses restricted to adults with hypertension and after excluding users of psychotropic medications. These results suggest that physicians should consider discussing these associations with their patients who are prescribed medications that have depression as a potential adverse event. So one area that I always look at in papers and should have a robust discussion of is the limitations. So they list several limitations, including the cross-sectional design of it. Medication use and depression symptoms cannot be temporarily ordered, meaning that you don't know which one came first. You don't know if it just happens to be that a bunch of depressed people are on medications that have quote-unquote depression as a side effect. Secondly, they kind of get into what we found in the earlier part of this video, which is the Micromedex software used to identify medication with adverse events of depression. They specifically talk about how it may exclude some medications with this risk. For example, Micromedex does not include all calcium channel blockers, although there is some evidence that there's a depression risk with these medications. Another limitation that they list is the NHANES data only captures information on prescription medications, which leaves out OTC medications like omeprazole that we talked about. So there could be more there. Lastly, fourth, they say that NHANES does not actually provide them a way to adjust for a history of depression, which would be a clear confounder here. Because again, if someone has a very significant history of depression, perhaps even a family history of depression, maybe there's some sort of compounding effect there where it's not actually the medications causing depressive symptoms, but just that person's history. And there is one more here. They say that these analyses do not control or include any sort of control for impaired hepatic or kidney function, which could alter drug levels, substance use, which is clearly connected with depression, or other potential confounders. So the other paper I provided you with was just basically a commentary on that Cato study, where they go through and they really give you the highlights of the Cato study, showing that a significant amount of patients take medications with depression as a side effect. They talk about the sensitivity analyses, and they talk about how there's numerous medications that include depression and suicidality, which I didn't really talk about in our table, as a potential side effect. They even highlight in this paper that the estimated prevalence of depression was 15% for those reporting use of 3 or more medications with depression as an adverse event versus 4.7%. So quite an increase there, almost a tripling of the prevalence there. And what they try to highlight here at the end of the article is that the researchers call for additional screening for depression, which would be pretty easy since even in the study itself, they used the PHQ-9, which is pretty quick, pretty easy, and fairly sensitive to depressive side effects. So something that you guys could think about including in your practices as you go out into the employment after you graduate. So circling back to our question, list possible reasons that could explain the association between medications that have a side effect of depression and the increased risk of depression. So what are some that we saw in the actual paper? That could be history of depression. So again, patients that have some sort of history or even a family history of depression could just be at an increased risk of depression versus an actual medication causing the side effect of depression. Another one could be that the side effects that are being seen, the supposed side effects, are actually some sort of just comorbid condition. So for example, certain disease states like diabetes, obesity, sleep disorders are actually associated with an increased risk of depression in of themselves. So perhaps treatment of disease states that have an increased risk of depression. It's really what's driving that increased rate of depressive side effects, not necessarily the treatment itself. A big one that could be is clinical trial reporting. And so when I say this, it really shows you the difference, or at least the kind of highlights the reporting by Lexicomp that we saw, which is that in a clinical trial, it's required by law and the FDA to report every single adverse event that happens to a patient during the trial in the package insert. So, for example, it's very possible that many patients have new onset depression, they have some sort of environmental cause of depression, and that ends up being reported in the drug label, even if it's spurious or not really associated with the drug itself. One final one would be, it's really hard to separate out other effects that cause depression, namely environmental and genetics. So it's really hard to tease those effects out. For example, depression due to bereavement, depression due to loss of job, things like that could definitely cause confounding in the data of studies such as the Cato study that we looked at, which is purely cross-sectional. You just really can't tell if those drugs are causing the side effects or there's something else going around in the background. Now, this list isn't all-inclusive. These are some ideas that I came up with. I'll be really interested to see your ideas and see what else you guys thought of. So that wraps up our video on depression as a side effect of medications. Thank you.